This course is an introduction to evaluating and utilising medical tests. All doctors use tests for their patients. It's a fundamental part of the profession, and we spend large amounts of money on tests. Yet there's very limited teaching on the nature of tests, their evaluation, and how to use them effectively. This course aims to fill that knowledge gap. Before we begin to evaluate and utilise medical tests, we'll need to ask ourselves what tests are and why we do them. A common answer to why we do tests is to make a diagnosis. But if that were the only answer, we would stop all tests as soon as a diagnosis was secure, which is clearly not the case. In fact, we do tests for all sorts of reasons, such as monitoring response to therapy, or to detect drug side effects, for example. In this course, we will be concentrating on diagnostic tests, which we will define very broadly as new data about a patient which helps us get closer to making a diagnosis. It's important to keep in mind that whenever we request a test, we're actually asking a question. So before embarking on any test, you should have a clear question in your mind and an appreciation of how the test can answer that question. The question might be simple, such as, does this patient with a reduced level of consciousness have low blood sugar when you take a finger prick glucose measurement in the emergency department? Or it might be more complex, like, what is the stage of this cancer when requesting a scan for a patient with known malignancy? The important point is that whatever test you are doing, you should be able to formulate a question that the test has a reasonable chance of being able to answer. If not, something is wrong and you need to ask for help. Remember, tests can be expensive and have side effects for patients, so you should only be doing them if you can see the benefit to the patient. The course begins by describing the simplest way of evaluating a test, called a diagnostic accuracy study. We use the example of pregnancy because of its simplicity. The test results are usually unambiguously either positive or negative, and similarly, patients are either pregnant or not, with no in-between states. We then move on to discussing terms associated with tests, which are derived from the diagnostic accuracy study. We begin with sensitivity and specificity, which are the most commonly used terms, and move on to positive and negative predictive values. After discussing the limitations of these terms, we turn to Bayes' theorem as a way of circumventing these limitations. Lastly, we look at thresholds for making decisions, as a way of showing how tests can, or sometimes cannot, influence patient management. We hope you enjoyed the course. Please feel free to leave constructive feedback, and remember to watch the videos right to the end, so that you're registered as having watched them.